Hi, this is Renee Labrie-Shanks with Montana SMP. Normally, you'd find SMP out giving presentations directly in your communities. We'll instead post videos, and we would appreciate your sharing them in order to help us reach as many people on Medicare as we can. This week, I want to talk again about scams related to COVID-19 because they're rapidly increasing as a public health emergency develops. And in order to protect yourself, it's important to first understand some very recent changes to Medicare coverage in relation to COVID-19. Guidance is evolving, but know that Medicare Part B will cover COVID-19 tests when ordered by your doctor or healthcare provider. And Medicare does cover all medically necessary hospitalizations, and this will include extra days due to any quarantine. And though there's no vaccine for COVID-19, if and when it becomes available, it will be paid under your Part D drug plan. And lastly, Medicare has expanded coverage of telehealth services and will now pay for more than 80 additional services when furnished via telehealth, which will keep you safe and in your home. And these include emergency department visits, routine visits, mental health counseling, preventative health screenings for cancer and other illnesses, and even home visits, all from your home over the phone. Unfortunately, with these additional services, as well as others, we can expect to see more fraud. And fraudsters are already attempting to bill Medicare for sham tests or treatments related to the coronavirus. To stop COVID-19 fraud, it's more important than ever to not give out your Medicare number to anyone other than your doctor or healthcare provider, and to protect it and treat it like a credit card. Never provide it to anyone who contacts you through unsolicited calls, texts, or emails, and be cautious of anyone who's coming door to door offering free testing, treatment, or supplies. Don't click on links from sources you don't know, and be cautious when purchasing medical supplies from over the phone by always verifying your source. And lastly, ignore online offers for vaccinations or ads touting prevention products or cures. These tips, along with always looking over your Medicare summary notice or Medicare Advantage explanation of benefit, will go a long way in stopping Medicare fraud. In addition to these Medicare fraud prevention tips, some other areas of concern during these challenging times include to always do your homework before making a donation to a charity or crowdfunding site, and to be alert of investment opportunities. The U.S. Securities and Exchange Commission is warning people about online promotions, including on social media, regarding publicly traded company stock increasing in value due to COVID-19. Also, the Inspector General sent out a warning about fraudulent letters people have already received threatening suspension of Social Security benefits due to COVID-19. Social Security will not suspend or discontinue benefits because their offices are closed. And lastly, there have already been reports of fake stimulus checks arriving by mail. Please question anything that asks you to give out personal information or to respond to in any way in order to receive your money. These are rapidly changing, developing guidelines, and if you have a specific question about your Medicare benefits, please contact your local SHIP counselor. And if you feel you've been scammed or would like help understanding a medical bill, contact your local SMP. Both can be reached by contacting your local area agency on aging at 1-800-551-3191. Outside of Montana, call 1-877-808-2468. Thank you, and I hope to see you next week.